as COVID-19 started to come across the land and it started to become very disruptive to us socially, schools, businesses began disrupted. We were really counting on the institutions as they were, the government to be able to provide us accurate statistics or accurate information on how we should respond, as they were trying to uncover the grandiosity of it all, the depth of disease, the real risk, who was at risk, coming up formulating treatment plans. The one thing that was left untended was the community at large. The community at large was sitting outside watching the news, not really getting meaningful information. Of the data sources that were available, the CDC, the individual state departments of health, they were severely limited. And what I found was when analyzing this data, there was much of the information was conflicting, it was falsely reported, it was reported very late. And after being a hospital administrator all those years, people still counted on me, and a bunch of administrators got together with some doctors and we talked about what the issues were. So one of the problems they had were people were panicked and showing up in the hospital no matter what they had. If they had an upper respiratory infection or allergies, they showed up as if they had COVID, and that led to cross-contaminating the population. So knowing what public health policy is and how I would operate in my hospital, I decided to create a program called Response Registry that would basically, and in effect, do the triage component of a hospital, of doing a differential diagnosis to determine what your risk or acuity is, not just for COVID and determining whether or not you need to be tested and isolated, but for any other type of disease. If you had emphysema, COPD, or other things that were causing you to have respiratory distress, we need to escalate you and get you to a higher level of care, whether it's an emergency room or an urgent care where you could be effectively treated, where patients who might have resisted going to the hospital for fear of COVID would get that treatment. So there was a collision of priorities from a health perspective. As COVID continued, the pandemic grew, more and more people became isolated, medications became more difficult to receive, people started, their behaviors and their stress levels started to impact them, and their physical health began to decline. Anxiety, stress, domestic unrest, things like that became more prevalent. So there started to become a psychological component. People no longer going to their AA meetings, their narcotics meetings, and there became greater risk to our society, even above and beyond the condition of COVID, affecting tens of millions of people. So Response Registry was the opportunity in here to do a quick differential and immediately connect you with either a physician through telehealth, a phone conversation. In certain counties, we could send a physician to your home instead of you going and risking infection at a clinic, and including all the emergency EMS services that would escalate your level of care, get you to a hospital, tell you where the local testing centers were, and try to get you to a physician or a clinic that would treat you in a cost-effective manner. There are still people out there who take advantage of these opportunities for profit's sake, and we tried to make sure we compartmentalized the cost and risk to manage the logistics for the community at large. We all did this for free, just as for a goodwill effort to let society know, look, we see you, we understand your problem. And the architect, a neurodivergent mind, architecting this solution, tried to cover all the bases in one single solution versus piecemealing this out, where you're constantly looking for the next piece of information of what to do. One stop allows you to get you from where you are to where you need to be in one fell swoop.